Hello there, I'm Dr. Jim. Thanks for stopping by. I have a serious topic, and it's one that a lot of our clients have asked for. It's one that certain states are now mandating in terms of continuing education every year, and it is sexual misconduct in healthcare. Okay, while this has probably always been an issue, not only in healthcare, but in all industries, sexual misconduct is now receiving more attention, and for some very good reasons. Studies show that over 10% of clinicians in the United States report that they've actually been sexually abused, harassed, or have experienced sexually inappropriate behaviors to some degree and within the last couple years. So these are recent events, not something that happened 10, 15, 20 years ago. And up to 14% say that they have not been on the receiving end of sexually inappropriate behavior, but they've seen it. They've witnessed sexual misconduct in their place of employment. So what is sexual misconduct? Sexual misconduct or sexually inappropriate behaviors violate ethical and professional boundaries. They can also cross legal boundaries as well, and they can be considered criminal acts in certain situations. So we're talking about some very, very serious stuff here. Let's talk about verbal advances. Some acts can begin as simply receiving unwanted sexual text messages, which are very popular, text messages are, or emails, but they contain sexually suggestive or explicit material. It could be verbal, it could be a picture, an image, whatever the case is. These acts can also take place in person and involve inappropriate comments about anatomy or body parts. Much worse, some individuals may verbally proposition their colleagues at work in the workplace, or sometimes patients, to engage in sexual activity with them. You know, as I go through this, I always stop and think, who the heck would do this? But there are people who do it. 10% is 1 out of every 10. Asking for a date at work is viewed by most companies as inappropriate in the first place. But repeatedly asking and harassing a colleague or a coworker is crossing ethical boundaries, and it's using power and authority. Some individuals in powerful positions may offer a promotion for sex in exchange, or they may threaten the employee with some type of punishment for refusing not going along with their request. And sometimes people go way too far. Some individuals will go much further than just sending texts, asking for dates, using punishment to get what they want. They may resort to being physically inappropriate in the workplace and deliberately infringing on an employee's body space. An employee might be the victim of physical touching, groping, or unwelcomed hugging. Some individuals may touch themselves in front of employees, and in the worst case scenario, there is the case of rape. Resorting to rape of a colleague or a coworker. Who's the victim? The majority of employees who've been exposed to sexual misconduct are women. While men are victimized as well, it seems like they have a 66% chance, a 66% less chance of being on the receiving end of sexually inappropriate behaviors in the workplace. So it's still women. Roughly the same percentage, though, of men and women have been witnesses to sexual misconduct. Who are the perpetrators? Sexual misconduct many times is an act involving power and control over employees by some kind of leader. In some studies, physicians are the main perpetrators of sexual misconduct, as are administrators, management-level staff, non-medical personnel, and even patients are the main perpetrators. On the low end are nurses, medical students, and nurse practitioners. Superiors are not always the perpetrators, though. That's important to know. Subordinates can also engage in sexually inappropriate behaviors with their equals and executive level staff. So what can be done? This is the important part. First and foremost, nobody should be a victim of sexual misconduct in the workplace or anywhere else. Companies' employees should maintain a zero tolerance policy regarding these behaviors. Any type of sexually inappropriate behavior needs to be reported and investigated. Not reporting only hurts the victim all over again, and allows for this type of behavior to continue to the next victim. Employees can reach out to someone that they trust in the workplace for help, support, advice. They can also call the National Sexual Assault Hotline. And here's the number: 1-800-656-HOPE 4673. Here's my takeaway. Sexual misconduct has occurred in every industry for years, and healthcare is no exception. Sometimes the perpetrator is in power, and there are times that a subordinate engages in crossing ethical boundaries, regardless of who it is. Victims get hurt, they suffer psychologically and emotionally, and sometimes are even forced to leave their place of employment out of fear. Sexual misconduct should not be acceptable in any workplace and must never, ever be tolerated. There you have it. Dark topic, serious topic, ethical topic, sexual misconduct in healthcare. If you would, subscribe to my YouTube channel. I would really love that.